How do you respond if a registered nurse or physician delegates a task outside your LPN scope of practice?
During a high-volume afternoon shift in an urgent care clinic, an attending physician asked me to administer an intravenous bolus of a high-risk cardiac medication. While I was trained in basic four-line maintenance, for push medications of this classification fell strictly outside the state LPN scope of practice and local health authority protocols. Recognizing the immediate risk to patient safety and my license, I calmly informed the physician that 4 push cardiac medications were beyond my legal scope. Rather than leaving the task unfulfilled, I immediately located the lead RN on duty, handed off the medication order with the patient's current vitals, and offered to take over the RN's routine charting to free up her time. The RN administered the bolus within 2 minutes, ensuring seamless patient care without violating safety boundaries. I learned that maintaining strict adherence to scope of practice requires not just saying no, but actively organizing safe handoffs so patient care is never delayed.
What would you do if you strongly disagreed with an RN's plan of care or recommendation?
In a 30-bed orthopedic rehabilitation ward, an RN directed me to mobilize a patient 3 hours after a complex hip arthroplasty. Upon reviewing the postoperative chart, I noted the surgical team had explicitly documented strict bed rest until a repeat hemoglobin check was completed due to intraoperative blood loss. I approached the RN in private and shared the surgical notes and the timestamp of the latest lab requisition. The RN initially believed the order applied to a different patient, but after reviewing the file together, she recognized the oversight and canceled the immediate mobilization order. The repeat lab results arrived 45 minutes later, revealing a drop in hemoglobin that required medical evaluation before any standing was attempted. This experience taught me that respectful, evidence-based advocacy using direct chart documentation is essential for catching potential errors and safeguarding patient care across multidisciplinary teams.
How do you balance working independently with working under the supervision of an RN or physician?
During my work in a community health center serving over 60 patients daily, I routinely manage assigned clinical duties such as wound dressings, routine immunizations, and vital sign monitoring autonomously. However, during a routine dress change for a diabetic foot ulcer, I observed new tissue necrosis, localized warmth, and a foul odor that indicated acute infection. While I independently cleansed the area, took sterile swab cultures, and recorded baseline vital signs, I promptly notified the supervising RN before dressing the wound or discharging the patient. The RN evaluated the site and collaborated with the staff physician to initiate oral antibiotics immediately. Balancing independence with oversight means executing routine protocols efficiently on my own while maintaining continuous vigilance to escalate subtle clinical changes to supervisory staff without delay.
How do you handle handoff reporting during shift changes?
At the conclusion of a 12-hour shift in a medical surgical unit caring for 6 complex patients, I conduct end-of-shift reports directly at the bedside using the SBR framework. For instance, when transferring care of a patient admitted with congestive heart failure, I detail his current fluid restrictions, exact intake and output totals over the past 12 hours, morning lab results including potassium levels, and current oxygen requirements. I invite the incoming nurse to jointly inspect 4 sites, surgical drains, and telemetry monitors while addressing any immediate questions. During a recent handoff, this bedside check revealed a slumping 4-pump infusion rate that had been miscalibrated during the previous hour, which we corrected together instantly. Standardizing handoffs through structured bedside reporting minimizes communication gaps, ensures environmental safety, and guarantees continuity of care across shift transitions.
How do you prioritize tasks during an unexpectedly busy shift or understaffed environment?
While working a night shift on a 24-patient step-down unit, where staffing fell from 4 nurses to 3 due to emergency sick leave, I was assigned 8 high-acuity patients. I immediately conducted a 2-minute visual assessment of all 8 individuals to establish a clinical baseline, identifying 1 post-vascular surgery patient exhibiting elevated respiratory rates and chest discomfort. I prioritized this patient first by performing an immediate targeted assessment, placing him on cardiac monitoring, and alerting the charge nurse, while rescheduling routine morning dressing changes and non-urgent oral hygiene for later in the shift. By delegating stable vital sign checks to a healthcare assistant, I maintained safe oversight of all patients while managing the acute issue. I learned that under pressure, effective prioritization relies on dynamic clinical triage based on physiological risk rather than simply completing tasks in chronological order.
Walk me through how you adhere to the rights of medication administration.
While managing medication passes for 15 residents in a long-term care facility during a busy morning window, I consistently apply the 6 core rights of medication administration at every step. Before preparing any dose, I cross-reference the electronic MAR with the patient's wristband using 2 distinct identifiers, verify the exact medication, dose, route, and scheduled time, and check for documented allergies. During one pass, I noticed an order for a blood pressure medication where the dosage appeared double the resident's historical record following a recent pharmacy transfer. I paused administration, rechecked the physician's original handwritten order, and confirmed a transcription error with the pharmacist before giving the dose. Adhering rigorously to verification protocols prevents catastrophic medication errors, reinforcing that thorough safety checks must never be compromised for speed.
What steps do you take if a patient refuses their prescribed medication or treatment?
A 68-year-old oncology unit resident consistently refused her evening dose of subcutaneous low-molecular weight heparin, expressing intense fear of abdominal bruising and needle pain. Rather than documenting a simple refusal and walking away, I sat down with her to explore her concerns and explain how the anticoagulant directly reduced her risk of deep vein thrombosis following her recent immobility. I offered practical solutions, such as altering the injection sites and applying a cold compress prior to administration to minimize discomfort. Understanding the rationale alleviated her anxiety, and she consented to the injection. I then documented her initial reluctance, the educational discussion provided, and the successful administration, while notifying the primary RN. This taught me that patient refusal often stems from unaddressed anxiety or lack of information, which empathetic communication and practical adjustments can frequently resolve.
What would you do immediately if you entered a patient's room and found abnormal vital signs or acute distress?
Upon entering the room of a patient recovering from abdominal surgery during routine rounds, I found him pale, diaphoresis-covered, and complaining of severe dizziness, with an automated blood pressure reading of 78/45 millimeter of mercury and a heart rate of 125 beats per minute. I immediately lowered the head of the bed, elevated his legs to promote venous return, applied high-flow oxygen, and pressed the emergency call bell to alert the nursing station. While waiting for assistance, I took a manual blood pressure reading to confirm the hypotensive state and checked his surgical dressing for signs of hemorrhage. The charge nurse and attending physician arrived within 2 minutes, allowing us to initiate fluid resuscitation rapidly. Acting promptly and systematically during acute deterioration stabilizes the patient while gathering vital objective data needed for rapid medical intervention.
Describe your experience with wound care, sterile technique, and infection control protocols.
In an outpatient surgical clinic handling approximately 20 dressing changes daily, I frequently manage stage 3 pressure injuries and complex surgical incisions requiring strict sterile technique. During a negative pressure wound therapy dressing change for a deep abdominal wound, I established a sterile field, verified the sterility of all packaging, and used sterile gloving throughout the debridement wash and foam placement. While removing the old dressing, I noted localized redness and purulent exudate, which I measured, photographed per facility protocol, and sampled using a sterile swab before applying the new vacuum seal. I reported the clinical indicators to the surgeon, who initiated targeted topical antibiotics based on the subsequent culture. This routine experience reinforced that meticulous sterile technique combined with precise wound assessment prevents cross-contamination and accelerates long-term tissue healing.
How do you ensure accuracy when charting and updating electronic health records?
During a busy shift on a medical unit caring for 7 patients, I ensure documentation accuracy by completing real-time charting at the point of care rather than relying on end-of-shift memory. Following every medication administration, wound dressing change, or vital sign check, I log into the mobile workstation directly outside the patient's room to input objective observations, exact measurements, and precise administration times. On one occasion, completing immediate charting prevented a duplicate dose of pain medication from being prepared by a covering nurse during my meal break. I also double-check patient identifiers before saving entries and ensure workstation screens are locked to maintain HIPAA compliance. I learned that real-time, objective charting is a critical communication tool that directly impacts clinical safety and continuity of care across shift transitions.
Tell me about a time you made a clinical mistake or charting error. How did you handle it?
During my first year as an LPN in a busy subacute unit, I accidentally documented a set of vital signs under the wrong patient's electronic chart during a chaotic morning intake. Within 10 minutes of saving the entry, I realized the blood pressure reading of 160/95 mmHg belonged to the patient in bed 12A rather than 12B. I immediately alerted the charge nurse to the documentation error, followed institutional policy to mark the entry as entered in error in the EHR, and re-entered the accurate vitals under the correct patient profile. I then performed a full clinical check on both patients to ensure no inappropriate interventions had been initiated based on the misfiled data. Taking immediate accountability and following correct rectification procedures mitigated any safety risks and highlighted the absolute necessity of double-checking patient profiles prior to saving clinical notes.
How do you handle an anxious, aggressive, or uncooperative patient or family member?
In an emergency department waiting area, an agitated family member of a patient waiting for lab results began shouting at the triage desk, demanding immediate admission and threatening staff. I stepped into a neutral position, maintained a calm, low tone of voice, and invited him into a quiet side room away from the crowded waiting lobby. I acknowledged his frustration, explained that his mother's vital signs were stable, and provided a realistic 15-minute timeline for when the laboratory reports were expected back from the facility lab. Providing clear information and an empathetic ear reduced his agitation significantly, allowing us to discuss his mother's care plan productively. I learned that de-escalating aggressive encounters requires active listening, setting clear boundaries, and offering transparent communication to alleviate underlying helplessness.
Describe a time when you had to deal with a high-stress emergency on your unit.
While monitoring a 32-bed long-term care unit during an evening shift, a resident experienced a sudden respiratory arrest following a choking incident. I immediately initiated chest thrusts, cleared the airway of visible food debris, called for the emergency crash cart, and directed a colleague to dial emergency services. While executing basic life support protocols, I assigned a second assistant to guide responding paramedics into the building and locate the resident's advance directives. Our team sustained continuous bag valve mask ventilations and compressions for 6 minutes until emergency services arrived and successfully stabilized the resident for transfer to the ICU. Remaining focused under extreme pressure and directing clear roles during a crisis ensured coordinated life-saving measures that ultimately preserved the resident's life.
Can you share an instance where you went above and beyond for a patient's comfort or emotional well-being?
During a 2-week stay in a palliative care ward, an elderly patient with end-stage renal disease became withdrawn and refused meals, expressing deep distress over missing his 50th wedding anniversary celebration. Recognizing the emotional toll on his physical health, I coordinated with the unit manager, dietary staff, and his spouse over 3 days to organize a small, private lunch in the facility garden. I arranged his pain medication schedule so he would be comfortable during the afternoon, set up a decorated table, and facilitated a quiet 2-hour visit for the couple. The patient's mood and engagement with nursing staff improved remarkably following the event. This experience proved that holistic nursing care extends beyond physical treatments. deeply requiring personalized empathy to support a patient's emotional dignity.
Describe a time you had a conflict with a coworker. How was it resolved?
In a busy pediatric clinic, a fellow LPN repeatedly left used treatment trays and uncleaned equipment in the shared utility room, creating delays for other staff during packed afternoon appointments. Instead of complaining to management or letting frustration build, I asked her to speak privately at the end of the shift. I explained how arriving to unclean trays impacted my preparation time for oncoming procedures and asked if there were specific workflow bottlenecks causing the delays. She shared that she was struggling to balance intake charting with equipment processing during peak hours, so we agreed on a system where we cross-assisted with utility room resets between patient roomings. Our workflow efficiency increased noticeably over the following weeks, showing me that addressing peer conflict directly and constructively fosters workplace teamwork and mutual support.
Why did you choose to become a licensed practical nurse?
My decision to become a licensed practical nurse stemmed from a desire to deliver direct, compassionate bedside care where patient interaction is most impactful. Prior to nursing school, I spent 2 years volunteering in a home health agency, where I observed how dedicated practical nurses transformed patient recovery through consistent monitoring, therapeutic communication, and hands-on skill. The structured, patient-centered focus of LPN practice aligns perfectly with my professional strengths in clinical assessment, empathy, and practical problem-solving. Over my years in practice, providing direct bedside relief and serving as a reliable advocate for vulnerable patients has continuously validated my choice. I remain committed to this career path because it offers the direct opportunity to improve health outcomes every single day.
Why do you want to work at our specific facility/organization?
I have followed your facility's expansion of its specialized stroke rehabilitation unit over the past 2 years, particularly your recent Clinical Excellence Award in patient-centered outcome scores. Your organizational commitment to maintaining low nurse-to-patient ratios and investing in continuous staff education directly matches my professional values as a dedicated LPN. In my previous clinical roles, I thrived in fast-paced environments that prioritize interdisciplinary collaboration and strict evidence-based safety standards, qualities your hospital consistently demonstrates. Bringing my expertise in complex wound management, post-acute monitoring, and patient education to your team allows me to contribute directly to high-quality care metrics. Joining an organization that actively fosters nursing excellence and patient safety is the ideal environment for my continuous professional contribution.
How do you keep your clinical skills up to date with changing medical guidelines?
To ensure my clinical practice reflects the latest healthcare standards, I maintain an active continuing education routine that goes beyond basic licensure requirements. Over the past year, I completed advanced certifications in specialized wound management and pediatric forecare, while regularly reading peer-reviewed nursing journals like the Journal of Practical Nursing. Additionally, I actively participate in monthly hospital unit council meetings where new clinical protocols and infection control guidelines are reviewed and implemented. When our facility transitioned to a new line of automated infusion pumps last 6 months ago, I volunteered to be a super user, training 10 of my peers on safety features. Continuously updating clinical knowledge empowers me to deliver safe, evidence-based care in an evolving medical landscape.
How do you practice self-care to prevent burnout in a high-stress environment?
Managing high-acuity workloads requires intentional self-care strategies to maintain mental resilience and physical stamina. I maintain clear boundaries by engaging in structured physical exercise 4 times a week, practicing mindfulness techniques during breaks, and strictly disconnecting from professional communications on days off. Within the workplace, I utilize peer debriefings following traumatic or high-stress clinical events, which provides a supportive environment to process emotional stress alongside colleagues. During a particularly demanding winter flu season where overtime was frequent, maintaining these personal routines prevented physical exhaustion and kept my clinical focus sharp. Prioritizing personal well-being ensures that I arrive at every shift mentally prepared, emotionally available, and capable of providing high standards of patient care.
Where do you see your nursing career in the next 3 to 5 years?
Over the next 3 to 5 years, I aim to deepen my expertise in post-acute care and wound management, working toward a formal certification as a Certified Wound Specialist, CWS. I also intend to take on informal leadership roles within the unit, such as serving as a preceptor for newly graduated LPNs and participating in quality improvement committees focused on fall prevention strategies. Long-term, I plan to utilize facility tuition assistance programs to pursue an LPN to BSN bridge pathway to expand my clinical scope and leadership opportunities. My goal is to remain rooted in direct, high-quality bedside care while continuously advancing my qualifications to support the overall clinical excellence of our healthcare team.